All right. Hello, everyone. Welcome back to the Ellington Ballroom for our afternoon breakout session, tackling one of the most challenging aspects of clinical research operations. Contract and budget negotiations shouldn't be a black hole or a burnout trigger. In this session, you'll learn about strategies for building contracts and budgets that reflect real workload, reduce delays, and set studies up for long-term success. Please join me in welcoming Kelly, Maya, and Dawn to the stage.
Good afternoon. We're a little freaked out by being up here, so we can't see anything. So if you're trying to do something funny or make us laugh, we can't see what you're doing. So welcome. There's this big bright light blowing in our eyes. We're thrilled to be here. We are charged with talking with you about some of the challenges that sites and sponsors face with budgets and negotiations, and the importance of how we can help each other in becoming efficient. We had a few prep calls and had other people on the call and ended up having Maya join us late, so I'm going to let Maya introduce herself, and then we'll finish up and come down and we'll start out.
Awesome. Thank you, Kelly. Hi, everyone. I'm Maya Pochiraju. I'm Chief Product Officer at the Contract Network. The Contract Network, we are a technology platform that helps sites and sponsors streamline their contract negotiation, leveraging AI. Prior to the Contract Network, I had several roles leading product and operations in technology and finance, and have been really excited over the last few years taking that experience, building technology and workflows to help streamline processes and applying that to clinical research. So excited for the conversation today, and hopefully we can talk about some tactics that everyone can leverage to streamline how sponsors and sites negotiate contracts, budgets, and generally just get studies started up faster.
Good afternoon. I'm Dawn Pittinger. I am the Enterprise Director of Research Compliance for Nemours Children's Health. We are an integrated pediatric health system across about 6 states. So my role, I have been in research for about 19 years. I did spend my first 14 years on the clinical research operations side, negotiating contracts, billing compliance, coverage analysis, you name it, a little bit of everything. And then I went to the compliance side, but now I can use my experience on the operations side to help our teams and then give that other perspective overall from compliance and how we can do better, and I can help them see things so that down the stream it doesn't come my way as a problem.
And I'm Kelly Willenberg. I'm the I'd say older person up here. I've been doing this for about 40 years, and billing compliance has really become part of what Kelly Willenberg and Associates does. We've been in business for about 17 years, and we do a lot with paybacks to Medicare under fraud and abuse, and coverage analysis, and helping the budget to get negotiated and the contract to get negotiated in an efficient manner with a consistency for all the documents. So when this group met, we had a lot of brain power on the call, and we talked about contract negotiations and how to streamline and do some of the things that are coming to the forefront, and we've heard it the whole time we've been here about AI. So one of the things we talked about was using ACTA for contract negotiations and some of the ways that you can utilize repeated items that you've done in the past. And I think Maya has a whole lot of background in this area, so I'm going to ask her to elaborate on using tools that you have that will help you.
Yeah, definitely. So as I'm sure most people in this room know, every time a new clinical trial agreement is sent from a sponsor to a site, it's often treated like a brand new agreement that's never been seen before. You start from scratch. And so what we really try and think about in our conversations with our site clients and with sponsors as well is we really, can everyone hear me? Okay, that better? I'm getting thumbs up. Awesome. So what I was saying is, as we have conversations with our site clients and with sponsors that we work with, really one of the main things that comes up over and over again is, how can we reuse the work that's already been done? If you've already negotiated with the same parties, is there an opportunity to have a master CTA in place and then just have amendments that you're adding on trial by trial? I think opportunities around ACTA, for example, we, in our conversations with sites, often hear that ACTA is only being sent to them about 10% of the time. And so while a lot of sites are happy to accept ACTA terms with just a few modifications, if more sponsors were willing to accept ACTA and send that as their default template, I think that would be an opportunity for us to streamline a lot of the negotiations.
Does your site use ACTA?
We do not. After our call, I asked our team, and they said, very seldom does anyone send that, but we would use it. We would have to modify it, but we don't see that our sponsors and CROs are sending it to us. So we found that interesting.
And when I asked clients, I said, do you use this? What tools do you use? I got the same feedback, was most sponsors aren't utilizing that tool. Some use the Magi tool, and then some are starting to use artificial intelligence. And I think that's where you can come in a little bit and talk about the product that you have and how that's enhancing. Because I think we're all looking for tools, because this is a hard process and it takes us weeks to do contract and budget negotiations.
Definitely. And I think one of the, tool aside, one of the big things is thinking about how we can streamline just that process. And so as we think about efficient workflows for contract negotiations, thinking first on the sponsor side, how can we streamline issuance? If you already have a master CTA in place with that site, how can we make that easy to just add an amendment? If you have recently negotiated a clinical trial agreement with that site, how can you clone that agreement and use that as your starting point? And I think the same is there for sites. So even if the sponsor is sending you a net new agreement, but you've negotiated that agreement previously, how can you use that work product really easily? And I think there's an opportunity for AI to help there, to help surface to you agreements you've previously negotiated, so you're using that as a starting point and not starting from square one every single time.
I think to feed on that, having that playbook. How many of you in here that do negotiations of some point have a playbook in hand? So every time you do something, you know exactly what you're going to do. So some hands. And then that takes the guess out of it, right? You've developed what as a site, what your non-negotiable language is, what you need, what you plan to get to. And if you can use that as guidelines, especially if you have multiple people doing it, right? It becomes consistent. My compliance hat will say, I like that, because if I had to come in and audit or look at something, it's transparent, it's documented, and it's consistent, rather than there could be perceptions based on sponsors if they're being given these better deals. Like, it gets into a lot of different situations. So that playbook becomes so important, from your master language for your CTAs to your budgets to what you're asking for, and give it to the sponsor early. Give it to them, and then they know. And I think that kind of ties into the challenges. If me as a site, and I tell you, this is my overhead, these are the bottom lines, we have to have these, and you as a sponsor see that and don't accept that, then you know what? We all need to just walk away, right? Why waste our time? But instead, they see it, they say okay, and then you get involved in your negotiation, and then it suddenly becomes an issue again. Well, wait a minute. 2 months ago, you had this documented and you agreed to it. And that's where sometimes they'll get escalated, and we're like, we're sorry, we're walking away. We're not going to minimize our non-negotiables.
And just to quickly add to that, I think there's an opportunity, to your point, Dawn, to just make sure that we're noting it as part of our negotiations, right? So as you're making those changes to the document, having your rationale or your justification side by side with that markup. So it's really easy for the sponsor to connect back why you're making that change, whether it's because it's something you'd already agreed to in a previous agreement, or to your point, it's a non-negotiable for your site.
Oh yeah, well, we did this agreement years ago. Well, you did it years ago. And some things have changed now, and now we've gotten to a better place, we've improved, and this is now what's current. So we might have accepted that 3 years ago. We can't accept that anymore. We have to cover our costs, we have to be consistent, and this is what it is now.
Well, I think non-negotiables are something people hate to bring up because they're afraid it's going to stall. And from a PI perspective, PIs do not want to hear that you see as something as non-negotiable. That, they're full throttle. We want to open the study, and a true physician, they want to care for their patients. I think some of the other challenges that we face in negotiations, and I see it every day, is decentralization. You've got too many cooks in the kitchen, and nobody has the same ingredients. So how do you circumvent that?
I think technology here is a great way to fix this problem with just collaboration. Having a single document that you're sharing with folks internally before you even think about your collaboration with the other side. Is there one place that you can escalate to different folks on your team? If you're a contract negotiator, but you need someone to help you look at the payment terms from the budgeting team, pull them in, tag them in the same place. And then once you have consensus internally, I think one of the big pain points we hear a lot is, how do I collaborate effectively as a site with a CRO and then trying to get through to the sponsor? And so that's another opportunity for collaboration. And so one of the things we spend a lot of time talking to sites or sponsors and CROs about is, how can you have clear escalation paths built into your workflow, where if there are certain topics or certain fallback points that are brought up by a site, how can you really easily know, hey, I can bring the sponsor in, do it in a streamlined way, but then more importantly, add to my playbook, add to my fallback language, improve my template going forward, so I'm not having that process happen over and over again with every single site, but I'm learning once and automatically having improvements even within that exact same study.
It's communication, right? Not just being hidden behind email, going back and forth. How many times does email after email, and it never gets to the point? Pick up the phone. Even internally, we'll find, different groups do different pieces. And without that discussion early on, it may not move forward as it needs to. And so if you can have these early discussions, your clinical teams, the PI, your coverage analyst team, your budgeting team, your contracting team, however it is, because we all operate very differently, right? Everyone has it set up differently. But if you're all on the same page early on and you know what the outcome, you know what to look at, and you're consistent there, it's going to help downstream. So when you move through that negotiation, if something is off, you're having that touch base again that maybe one of the other teams say, hey, this isn't what we thought was going to happen. But you're doing it before you're opening the study, before you're putting patients on, which, of course, with amendments and, it's an evolving, it keeps going, right? But if you can try to do that up front and communicate, it becomes key and to your success.
Well, and I think knowing when you can escalate, when you should, and having a clear parameter and not delaying that. Asking for the sponsor to be on the call, or asking, using your team to communicate and coordinate and have everybody singing the same song, because what sometimes we see is the budget department is going down one pathway and the contract department is over here, and they're not synced up, so the sponsor is getting, competing information, which that sometimes brings up a lot of questions. And then you throw in a CRO, and, knowing when you should go around the CRO and having a clear communication with the CRO. And I think sometimes we've seen a lot of turnover, not only at sites, but at CROs in the past couple years. And I think sometimes we lose because of the lack of communication and collaboration together. So, what are some things that you can offer for CROs and how to work better to be efficient?
I think something that's been interesting, we've even heard it over the last day and a half here at the conference, is that sponsors want to get involved. They don't want to be a bottleneck to the process either. And so I think it's incumbent on both CROs and sponsors to have that clarity in escalation and not say, let's wait till round 3, 4, 5 to have the escalation happen. But everyone wants to get the study started faster. And so how can we have better communication between the CRO and the sponsor themselves so that escalation path is clear and sites don't have to go around the process is improved?
Now, that's great. Have it part of your playbook, right? Have that escalation process, that it's set. And so your staff, everybody knows that when they come to an impasse, what their next step is, not waiting for someone to tell them, but then it's consistent. So if we know we're waiting X amount of time, or we're going back and forth so many times, or these certain areas are at an impasse, what do? They know that path to follow and who to involve. And the CRO and the spot know that ahead of time, because if you're giving them some of this information ahead of time, and again, you have your internal documents versus your facing documents, then you have a better path forward.
Well, and it's the surprises that stops people in their past. And we talked about on our prep calls the fact that there are still sites today that have no research fee schedule. They negotiate a new type of budget with every single sponsor. They don't have a set fee schedule. They're not being consistent, and sponsors get confused because you've negotiated with them in the past a different price. So do you have a fee schedule at Nemours?
That was one of the big pushes with me. I just joined there in December, and our new clinical trials business office manager came in June, and so we are now about to get it approved. So a research charge master with updated we had fee schedule, we had a path of how they did budgeting, but we have now improved it, made it more consistent, especially because we are across different states. So we have a main hospital in Florida, we have a main hospital in Delaware, so different rules. Florida has a lot of legislation, a lot of specific rules when you do research in Florida that may not apply in Delaware. There are a lot of considerations. So we were able to take a lot of this and put together an enterprise-wide one, because what we would find too is a sponsor would say, well, we did this with you in Florida. Why are you asking for this in Delaware, or vice versa? And how do you explain that? Well, there's some reasons for that, but now with an enterprise approach, that question gets taken out of there. So we're pretty excited about that, because I know it takes sometimes a long time to get those research charge masters and get this implemented. So we've been able to move in lightning speed in something to get this going. So we're pretty excited about it.
That fee schedule and pricing, it helps because Jim, you said on the call, one of the calls we have, that it's a blessing and a curse to have precedents. So if you've done things well and you continue to do things well, you're good. But if somewhere along the line a new coordinator or someone negotiated an off budget and didn't use the fee schedule, you're put up. They put it back up in your face a lot of times, and so you're faced with, well, now what do we do? And I think another thing that we see with sites is a lot of sites don't really have a set startup fee. You know, what does it really cost to get a study started? And that they stick with it, that they're not looking at fees as this is a sliding scale and we'll put it wherever we want with whatever a sponsor gives us. My recommendation is a site have a set fee, and they know what their costs truly are, and they stick by it. And that's the fee that they charge every sponsor. And we sometimes don't see that. So you'll see sponsors that come back and say, well, the last time we did a study, it was $12,000. Why is it $20,000 now? And I understand why they're asking those type of questions. Maya?
Yeah, I think there's an opportunity, to your point, you know, if what you've previously agreed upon is no longer what it actually costs you to do business, how do you share that data with the sponsor, right? Because to your point, leveraging precedent is only as helpful if it still reflects the reality of the current stage. And so if you now have information about how much it actually costs you, other example studies that you can point to, information you can share with the sponsors, I think that's a great opportunity to have a moment of coming together to say, this is the reality of what it actually takes to carry out the study. We want to make sure we're appropriately compensated, and here's some facts that can actually explain that.
Well, that reality is what I would say we sometimes see a very light weight in that area. And what I'm talking about is, what does it really cost to do the study? And in the real world, having someone to look at a budget from the clinical side and tell how long it takes to consent, how long it takes to collect data, how long it takes to actually do a type of procedure. Those are the types of things that we sometimes see woefully under budgeted. So from the budgeting perspective, to get into the negotiations, you really have to have that as a a bump spot, and you've got to have some clinical input. So utilizing your clinical team, coverage analysis in my mind are the beginning of this, and one of the probably biggest challenges. It's a hidden challenge for how to budget. But when we find a site that doesn't do a coverage analysis, they really don't know what it costs to do the study. So I'm going to let you two elaborate on that.
That's a great point, because protocols are written, scientifically and clinically. They're not written financially, right? But you have to operationalize them, cover your cost, and then ensure billing compliance downstream, which does not align with what is given. So if you don't have the expertise or the people asking the right questions, you're going to miss things to budget. So there's where some justifications. What do we see? Imaging could be on your schedule of events. Well, imaging can be a loaded word, right? What kind of imaging? Contrast, with or without. Children, usually under the age of 6, have to be sedated. So there's another cause, another cost. So if you don't have that right expertise looking at that when you're doing the budgets that gonna stem down to the billing compliance, you could be leaving a lot of money on the table. A lot of hospital fees, professional fees, time and effort. There's so much to it, and it's that communication and understanding exactly what everything means downstream. And capturing it, because that's a whole nother piece we're not even talking about at the moment.
To piggyback off of this, the three of us were having this conversation earlier. There's often items missing between the different pieces of documentation that you receive at the beginning of the study as well. And so to your point, maybe the protocol doesn't have every line item, but often taking the budget, the protocol, maybe even the lab manuals, comparing all of those different line items, understanding where the gaps are, and incorporating that into your budget negotiation, that's a really key component. And we know a lot of sites are doing this today extremely manually. It takes a lot of time. Kelly, to your point, teams are decentralized, and so it's coordinating across a lot of folks. And so this is another area where I think, leveraging technology to really bring these forms together to give you that information early in the study, and so you're addressing all those gaps before the study even begins, can help with a lot of those downstream impacts.
Because if then you think about doing all of it, so these are the business decisions, right, that are being made and how you're going to go about it, but it's almost not remembering the patient aspect downstream. And I'm a huge proponent of reducing financial toxicity risk. And so the other part of this is everything that you're doing is going to be reflected in some manner in that informed consent. And the informed consent is now the contract that the patient signs, and that's what upholds. So if you are all willy-nilly up front, there's no consistency, how are your informed consent documents going to reflect this information so that when your participants are consented, they understand that piece, not just about what clinically will happen, safety, but financially as well. So it all plays a huge piece, and you can't do one without the other. It has to all flow along, and so you have to have these congruency checks. So finding ways to do that, and I know Maya showed some opportunity, but that congruency check before you're putting patients on study is huge to this entire process.
I'm the person that will say that, the patient's disease process has to be thought about. And in working with oncology, you're not only treating their cancer, a lot of times you're treating comorbidities because they're diabetic or they have hypertension or they've had a stroke in the past. So many other things that come into play that as to how that calendar gets built, what types of services you have to consider, and to your point, what is not on that calendar, that schedule of events that you might have to do or that might become an issue in a budget or a contract negotiation, because a lot of times we leave those types of things off and then we're looking at it from an unscheduled visit perspective. And sometimes that can be challenging if you haven't thought about it initially where you're putting together all your documents. So
yeah,
go ahead.
Especially on that, doing this early and ensures that you're getting it covered in the clinical trial agreement itself, because ultimately that's what's being signed, and you want to make sure that it reflects accurately all of this downstream information.
You go to a PI, well, that's standard of care. I do that all the time. You get those. Well, In the context of research, to me, I don't care. I don't care what you do clinically, because now we have research involved and we have to vet that, because clinically doesn't equal reimbursable, right? So a lot of times we'll have to go back to them and say, well, do you have 5 patients that had this diagnosis that would meet this criteria? Let me see what you've done. And in many cases, yep, they're ordering imaging, they're ordering a lot of things, but guess what's happening? They're being denied, and the patients are paying for it, but they have no idea because they did their clinical part and on it went. Well, now with research, we have to make sure that we're vetting that appropriately.
Well, and unfortunately, a lot of people who become burned out, so to speak, in doing negotiations, they sometimes don't have all the tools that they need. And you know, if you're, how many of you have every position filled at this moment in time? Anyone? How many of you have open positions? How many of you are doing 3 jobs because you're short people? Okay, therein lies why we're all burned out. And unfortunately, these trials are getting much more complex. And there's a lot of things in these trials today that there's not billing rules for, such as a lot of the CAR T-cell therapy that's going on. A lot of CAR T studies are essentially non-billable, but what we're seeing in budgets is, oh, well, we're just going to bill it and take our chances. So I think you have to really have some clinical knowledge to look at that and to really consider what should we be doing, because if you're putting this process into a person's role, responsibility, and they have no training, they have no idea what's in a study calendar. We sometimes see one area doing a coverage analysis, a separate area doing a budget, and a third area doing negotiations. Nowhere are they talking, and off over here, the IRB is doing the consent, and nobody's put all of these together. And if they're not together downstream, there's no way that budget is going to be right based on what's in that consent. So there's a lot to this, and I think burnout starts with we're not training people correctly, they don't have the knowledge, we're telling them to do things, and they're just doing it, and as many of you raised your hand, you're doing it because you don't have enough help.
So it becomes, I did not touch the bottom of that. It comes down to also to feedback, right? So if you're finding something downstream, is there a mechanism or a way that feedback is going back to the team? So let's say downstream billing compliance, we're seeing a lot of claims getting denied, different things happening in the context of research. Is there some review, and then you're going back to the budget team maybe to say, hey, we're seeing this, maybe we need to evaluate this deeper. I was at Moffitt Cancer Center through the self-disclosure and the $19.5 million payback for clinical trial billing issues. Lived it, breathed it for years. It's not fun. So everything that I learned based on the government's perception, based on what we found, based on root cause, what caused it, plays into my role now as a research compliance director and how I try to help my site not get into that position again. And part of that was feedback. People didn't know what they were doing, might have been causing issues downstream. So we were able to implement some big picture type training. So if we identified an issue when we were doing our audits continually, we would find something, we would share that across all the groups so they understood their piece of the puzzle. This is what I do, and this is how it impacts this step and this step. And if this is off, well, 3 steps down is where it might come to light and be a problem. So we would do that, and it was huge because a lot of them said, well, I didn't realize. I didn't know that that's what happened. Thank you for sharing that because now I understand it. So keeping people in their role, but expanding what they need to know so that they can be compliant and more efficient and understand what might happen downstream.
I think that's where the communication and collaboration really comes in. To your point, how can we give folks visibility? So those congruency checks that are being done across the protocol, the budget, the trial agreement, and the ICF, it might be a third or an extra team that's actually doing that, but is that information then going back to each of those individual folks? Do they have the ability to view that, read it, understand that they need to now update their policies or their playbooks as well? So there's that constant feedback loop. And I think, go ahead.
Now, hopefully it's not going just back to the manager and it's going into a drawer. They're addressing it, they're putting CAPAs in place, and they're moving along, and the people doing the work aren't getting that information. And so that's a huge piece of that communication and empowerment. And, every manager, leaders are different, but setting that stage and that message, and that was one where when we would do this, we wanted all of the users, everybody involved in the process was to be involved in this. It wasn't just management, it was everybody, so that we could make changes and everyone heard the information.
And to that, then disseminating those changes in a really effective way. And to Kelly, your point on training, it's not just saying, here's the change, but the why behind that as well. And so as much as possible, trying to give folks an opportunity to understand, maybe there's a new clause that's been added to clinical trial agreements recently. How do we educate our teams about that so they have context around what they're marking up?
I think that's a huge piece. Am I loud? I don't feel like we're playing musical mics up here. Just bear with us. That's a huge piece. We're collaborating, yes, communicating. I think it does boil down to, how you put the information out to the people, and in that constant training. I do like what you said it in the last session. You just talked about it, is having that, who is doing the consistency check? It may not be the person who negotiates the budget or the contract or does the MCA or actually finalizes the consent. But we've seen sites now come up with a group of individuals who their role is that only piece, is to ensure that everything is synced up. I've seen it called the mod squad. I've seen it called the carrier. I've seen it called the stop and go. But who's doing that and what does that mean? So if it does have to go back through, the team that put it through doesn't feel demoralized. And they get the information back, and then the next time they'll catch that. They'll say, oh, we forgot about that in the last one. Let's make sure that's in this one, especially if it's something new in the contract. I mean, that's a great point, is sometimes there's this whole thing with AI being in contracts. That's brand new. Have you trained your teams on that? What they're seeing, what's being put in, and what should be put into a contract? Those are really important items that you have to consider, and how do you get that information out?
And we often talk about it's a huge deal for sites to be doing these congruency checks and ensuring consistency, but there's a massive opportunity for sponsors to be doing the same thing, right? How can they be empowered with the same tools and technology so a sponsor is comparing their clinical trial agreement, protocol, budget, and sharing a really updated version of each of these with the sites? Because ultimately, any changes that they're making first, you're just gonna get even more efficiency as it's now shared with the sites for the back and forth to go.
And if not, then what? It's an amendment, it's more work, it's costs, it goes back to the IRB, it causes just more complications, right? You touched on a good thing. Everyone, no matter what role they have, is part of the team, right? It's for whoever I've worked with, we're all a team, whether I'm in compliance, legal, operations, the IRB, we're all there for a reason. We all want our jobs, and we're there for the patients. We're there to advance research, but we're in it together. It's not a us against them. It's not I'm going to pick it apart. And as a compliance person, a lot of times that's how we're looked at. We're looked at as a roadblock. We're looked at as the no people. That's not how I operate. I'm going to get you to yes. Let's just figure out how we can do it where we're not going to get ourselves in trouble, because I have a different perspective, and they have embrace that, and they want to do what's right, but they just may not know, right? So being able to see the big picture and then disseminate that. So if your compliance teams, and not everybody has that experience and that collaboration or strategic partnership, ours is very much a strategic partnership. And I'm sorry if you don't, but when it works, it's very powerful, because it can help the organization and ultimately bring that research in a compliant way to our patients and protect the organization.
Powerful and efficient. I mean, if the more compliant you can become, and I agree, you have to we have to rely on the CROs, the sponsors, and the sites to all be doing this together and to work on it together. Because from a compliance perspective, none of us want anything to go awry. But it's that one little item that gets left off that might cause a whole lot of problems downstream, that might cause the patient to get an exorbitant balance bill. And those are the types of things that I think we all don't want to happen, but where we are today is it takes days, if not weeks, to get a coverage analysis or a budget or a contract finalized. And how do you make that efficient so you can do the consent, make sure it says what you're doing and all the other documents, and bam, you're ready to go. Because that's where we want to be. And we should be able to get there with artificial intelligence. There's no way around it. So do we have any questions in the audience? Anyone? Anyone have the perfect way of doing budget negotiations? Go ahead. Right.
And the feedback I'm getting from some people are there's too many lines. This is way too much. Can you just combine it? And then other people say, well, these things may never happen, so why did you combine it in one large fee? We're not going to pay that for it now. So is there a happy medium?
That's a good question. That's a great question. And some of it, I imagine, is driven by what CTMS they have and the functionality, because we do see some of the CTMSs that it's better if you divide every line out versus having it all encompassed. I don't know. What do you guys think? That's an interesting question.
Well, I would say if you break it out, and I'm one, like I want the teams to break out things internally, right? And then what you give the sponsor might be different. But if we don't break it out internally to know exactly if maybe you have the functionality that your billing grids and such integrate to your EMR, so now that's going to drive different things. You have to have those line items. You have to have certain things. For me, we touch more on those billing compliant, those CPT code driven, anything that could potentially generate a charge in a billable system. That they really need to break those down, because you could have hospital, everything operates differently. You could have your organization do the technical billing, but it could be another group doing the professional. So how do you then manage downstream? You have to capture both of that if it's paid by research. So if you don't have that broke out to operationalize it, you could get yourself into billing compliance issues. Some of our sites, we also partner with some affiliate hospitals. So we own all of the physicians are ours, but the hospitals are theirs. So now we have added layers of things that go into our budgets because they charge a fee to review. Well, we're not going to pay. That's going to go back into the sponsor budget. They have certain fees. So again, that's part of that up front too. Like you're going to see additional fees because you want our patient population that is at that affiliate hospital. And so that's how we have to do this. But sponsors' budgets don't always capture it. And so if they want, if it's invoiceables, if it's something that may not always happen, of course, then invoiceables, it's on the site to now capture it, figure it, invoice it, collect it. The sponsors aren't just going to give us our money, right? But if you are really thinking about the compliance first of your organization, you would want to line item what you can so that you can capture it downstream. And I speak that from lessons learned in self-disclosure.
What do you think about budgets have combined lines? Is that, you do negotiations all the time. Do you see that that's something that is better broken out? Do you see it broken out a lot, or do you see it as lump sum, like hematology, and then it's an amount, and it has all these listings under it?
Yeah, we're generally seeing what you just described, where sites are rolling it up for the sponsor budget potentially, but they're breaking it down in their own internal budget. And so being able to maintain your mapping between your internal budget and your sponsor budget is really important to help make sure that you're not missing any items between the two.
So it's that balance of what information you give, but making sure it's very clear internal, because you have to operationalize it internally.
Well, and always having compliance as an overlay. I thought it was interesting in the last session, one of the sessions this morning talked about, these data managers, clinical data manager are going to become quality overseers. Compliance oversight is really what is the stem of having a good contract, a good budget, a good consent, and a good coverage analysis. Who is the oversight, and where does it sit? Who has that authority to say, stop, we need to look at this, we've got something that doesn't align? And I have clients that still haven't figured out how to do that, and they're paying back money. So, and the government, CMS is starting to scrutinize, and they're putting out what they're going to start looking at. And, device studies are going to be front and center because they're high dollar, high ticket items. We're just going to have to keep moving and keep working on collaborating with a compliance mind, or we will be in trouble. So I think that's what I'd like to end with. A comment from both of you before we stop.
I think it's also the balance. So burnout, your teams have so many studies, because again, what PIs are just bringing studies in, and if there's not a great way from a different input or review period that puts some parameters around that, right? We can only handle so much to where your quality starts being impacted. And so what is that balance? Are your teams okay and empowered to go, I can't take anymore? I have 20 studies in the pipe. I can't manage. I'm not doing well, without the fear of them getting in trouble. So putting that out there to where there's some sort of review or mechanism that is watching that inflow of studies that come in, and know when to either draw the line or get additional FTEs to help. If the organization is going to push research, you have to have people to support it.
And I would just encourage everyone in the room to think about, where are there the opportunities to leverage technology for those repeatable moments, for the items that are happening every day on every agreement or every budget, so that your teams are then spending their time leveraging their expertise to figure out where are the exceptions, where is something new, where do I need to collaborate with another team on, but they're not getting burnt out doing the exact same routine task that just requires them to get their job across the finish line. And so I know there was a ton of conversation just over the last few days about how different types of technology and AI can help us do that. And I would just encourage everyone to think about those routine tasks for themselves, because I think there's a massive opportunity for us to give folks time back to really spend on the critical components of their jobs.
Any last remaining questions? Well, we are excited that you decided to spend the first session after lunch with us, because we know everybody was sleepy. So thank you. We look forward to seeing you again, and thank you to Research Revolution for having us.
Thank you.